Hey, everybody. Welcome to the Tech Connect podcast. I'm John Martin.
And I'm Dean Reverman.
Dean, as this podcast has come out, and about a week after I think we're recording this, we have hit about a year since Blue Star changed up their operations entirely, since, let's be honest, most of the world changed pretty dramatically.
Yes, sir.
It was about mid-March in 2020 that things really started shifting. Businesses had to figure out what to do next. The pandemic was beginning to spread rapidly across the U.S. and the globe in general, and it's we've hit some very somber milestones along the way, but we've also learned a lot. And especially, I'm sure, in the world of healthcare, more than anywhere else. And we talked about this a few times, I think, over the last year. We've mentioned several times necessity, the mother of invention. Again, not a necessity.
Now we're all experts on virus. Now we're all experts on blah, blah, blah.
Not one we wanted, and not ways that we wanted to learn new things, but a lot of cool, interesting stuff has happened that we have learned, and a lot of new technology and new innovations have come out of this.
I would agree.
So that's kind of going to be our topic today. We're going to talk about kind of what has COVID taught us about healthcare technology over the last year, what's changed. We have Mike DeLibero with us from Agilent. He's going to be a great guest to talk a little bit us through this particular topic.
Absolutely.
So we're going to get into things like, we're going to talk a little bit about Agilent and how they've kind of approached this whole cycle, what changed for them over the last year. We're going to talk about some of the challenges and pivots and surprises over the last year, what technology is breaking through that maybe wasn't before, that was been out there, but necessarily wasn't really breaking through. And also kind of maybe predict a little bit of what's next on the horizon.
Oh, the crystal ball again.
That's right. We always got to break that out.
That's right.
We need to go back and listen to some old episodes and find out if we were right about anything, or if we just going to go, no, we were idiots.
Yeah, right. Exactly.
So all that plus our usual value to the VAR and what's tech connecting with us, it's time to plug in and get connected.
Welcome to the Tech Connect podcast. It's time to get connected.
All right, as I mentioned, our guest today, Mike DeLibero, is the Director of Healthcare Sales for Agilent. Mike, thank you so much for being on the show today. Tell us a little bit about yourself. How did you get to where you are? How long have you been with Agilent?
Thank you. Great to be here. I've been with Agilent for about 9 months now. I've been in the IT, healthcare, state and local government space for about 20 years. My charge here at Agilent is to grow our healthcare footprint. I came on, we already had a solid base of accounts, but over the last 9 months, we've been working to onboard best-in-class solutions to go to market to our clients and prospects.
Well, then, let's talk about that, and let's talk about Agilent in the world of healthcare. What is your approach to that space? Obviously, things changed a lot in the last year, and maybe you can talk a little bit about some of that pivot too. But more importantly, like what do you think about when you're approaching healthcare? I know it can be a bit daunting and intimidating for a lot of people. It's kind of can be a little slow moving is what you hear, and maybe a little resistant to change sometimes. So what is it like for you?
Well, I think it's everything is it's been a major shift in terms of how we organizationally operate. Most everybody being virtual, and it's our current account base being virtual for the most part. The only people that have remained on site at hospitals are those people that service the end user community at the hospitals, or our clinicians. For safety reasons, the rest of the healthcare employees have gone to a remote setting. So those folks who work in infrastructure and administration, those are no longer people that are on site. So the challenges that we've had is going to market and making sure we're still continuing to make ourselves available to that population, and working with the clinical folks at hospitals to see what technologies we can apply to help their combating COVID-19. And most of the solutions are around clinical endpoints and infection control.
Yeah, interesting that the people aren't, you don't have as many office workers in the healthcare setting anymore, right? So from a sales perspective, you need to get in front of those stakeholders from time to time to develop the solution, make sure you're having the right solution. So has that been a challenge, Mike? I mean, trying to get in front of all the stakeholders, because we've been talking a lot about how technology is just just certain technologies, you're stepping on the gas trying to implement them as quickly as you possibly can, especially in this pandemic. So what's that been like in the healthcare environment?
It is a challenge for a certain set of stakeholders that you usually would all be in a room with and be able to. It's great. I think we've all adapted to these virtual Zoom, Teams meetings, but I would be lying to you to say it's not the same level of interaction and same kind of bonding event. So if you've got an already established customer and you've known them for years, it's understandable. But if you've got prospects that you're just getting to know and they're just going to know you, you have to work a little harder to build that foundation. You just need to keep plugging away, and certainly around the clinicians and working with departmental heads, we still have that opportunity to go into hospitals to understand what the workflow is, to understand what the goal or challenge that this particular solution is going to remediate. So you still have that opportunity, but in areas such as data center, that can be a real challenge to get those those meetings and get in and speak to those folks.
Yeah, definitely. I can't imagine that it's. I mean, again, it can be difficult to get all the right people together under ideal circumstances and situations, especially if you have a lot of people coming together to make a decision. And again, in healthcare, I know a lot of different people probably have to weigh in on things. We're working predominantly maybe on the IT side of things, and we need them to be there. But you also want the people that are using technology day to day. You want the folks at the managerial and director level. You've got, upper level executives that probably want to weigh in. So, yeah, kudos to you for holding it together and keeping at it over the last year and just understanding how this world works.
And compounded by the fact that there's the need for technology solutions, unlike there has been, especially in healthcare. Yeah, in a very, very urgent way. So it's like you want to help make the best solution, but sometimes not all the stakeholders around. That's got to be a challenge, no doubt.
So let's talk about Agilent a little bit and the way you approach your value add proposition. It's obviously a big part of our particular channel is this idea of being a value add. So maybe without giving away too much of what you do that's special, to any listeners, but how do you define value add when it comes to working with customers, and especially in the healthcare space?
Yeah, I mean, as people who sell, your goal is to sell something, right? Whether it's a SKU, a product, a service, that's what we do. But making the effort to understand more deeply the solution, the technology, beyond just a basic level of what a particular product does, gives you the ability to distinguish yourself from your competition. But at the same time, you've got to work very closely with the manufacturers, communicate with them wherever you are in projects, because in most situations, resellers are leading in the project. So the manufacturer community depends on you for updates on where we are in terms of milestones to closing business, to deploying products and solutions. So you've got to just over communicate to your clients, make sure you're doing the research. If they're asking you to be we always want to be a consultant. We don't want to be just someone who sells to them. We want to always take that consultative approach. And when it comes to up deploying the products that Agilent deploys, we take the time to do site surveys, walkthroughs, really understand how these technologies are being implemented, not just sell them. And that's the differentiator.
Mike, let's go a little bit deeper on the vendor communications, because John and I have talked about this, and we've had other guests on when we talk about the importance of for resellers to have really good relationships with their vendors. And you were touching on the vendor communication. Obviously, there's the need for the communication back to the vendor. Here's the status, things like that. But talk to us a little bit about how you work with vendors and the relationships you try to deal or develop with their vendor reps, their DCAMs, and stuff like that. Do you put a priority around that, and what are some
absolutely
absolutely
Dean? To be successful, it's one of the keys to the kingdom. You've got to develop and invest in making those relationships really solid, and it's not just the manufacturer relationships, the distributors such as Blue Star, working with those named product champions within Blue Star to just have that whole ecosystem and good communication, We just don't want to wait for business to come to us. We want to go out and do some demand generation, see where we can jointly uncover opportunities where none existed. So it's very important to just have a consistent cadence with the manufacturer community, let them know what you're working on and that you are evangelizing and positioning their products.
Absolutely. Because when you think about the value add to the customer, I mean, when you as a reseller are walking in the door and you are arm in arm with the vendor, and I mean, you guys are that well integrated and you're working on each other's behalves, man, that puts a nice front in front of whoever the decision maker is on the other side, that, hey, these guys are obviously in cahoots. Well, not in cahoots, but they're obviously strategically aligned.
Right.
Yes, maybe
Cahoot doesn't have to be
too.
a bad word.
It doesn't necessarily, but they're strategically aligned, and there's a lot of value to that,
Right.
right? When you're trying to add the value of the solution to it, the more lockstep you are, to me, the better. I mean, right. There's different ways you could perceive that, but man, I'm telling you, that's a real advantage when it comes through.
And Mike, I like the way you framed the idea of over communicate, and it's one of those things that as a marketing person, sometimes you hear that and go, "Oh, that's not something we're supposed to do, right?" Like it's a little scary. But at the same time, I imagine this is kind of the way you're thinking about this. And I know healthcare is one of these industries, especially where you can't expect every communication you put out there to be focused and read and time put in. You don't know what's happening, and especially again, if I think over the last year, anybody in healthcare has got to be just strung to the thinnest point they can possibly get to.
Right.
And to expect them to have the time to sit down and read some email that you sent or review some video or look over some proposal, it's just not, it's not something you could expect of them, even at the best of times, especially then over the last year. So I like the idea and kind of what I'm thinking there, and I imagine it's where you're going too, is this idea that, hey, it's keeping in touch. It's constant communication. It's letting them know, like, hey, we're here for you. Maybe what I sent last week to you or referenced last week to you went over your head because you were too busy, but I want to get back around to it. I'm coming back and letting you know about this, about that. Here's something interesting I just came across the other day I think you might be interested in. Is that kind of what you meant by that idea of over-communication?
Yeah, not communicating in an unproductive way or, a bothersome way, but just making sure that, what we're trying to position and we think may add value as you go through COVID-19 challenges, could be now COVID vaccinations sites and the equipment needed to outfit these pop-up COVID vaccination sites. So giving some thought to what would be front of mind to the healthcare workers and the IT people in hospitals to allow them to best do their job.
Absolutely. And see, that's why I think, companies like Agilent are so well positioned that they are in lockstep with certain vendors, that they've developed the relationships. When the time comes for the healthcare entity to need that pop-up vaccination or whatever it was when we're back doing pop-up testing, which we're still doing today, it is so nice for them to be able to have a relationship already with a reseller that knows what to do,
right,
and can really expedite the solution garnering and adaptation and execution across the board.
And if they've only heard from you just once or twice,
right, exactly,
you're not the person they're going to think of when they think, oh, I've got a need suddenly. If you're that person they've heard them on a regular basis, regardless of whether you're doing any business with them whatsoever, that was always something I found important in sales is, hey, there's going to be times that I'm going to communicate with people that are going to want nothing to do with me or not be buying anything from me. But that doesn't mean that I can't still have a relationship and we can't still be talking, even if they're not, handing me a PO or, giving me their credit card or whatever to buy something.
Absolutely.
Because, again, that pays off in the long term. So that point they reach where they go, man, we're suddenly ramping up all this testing. We need a bunch of mobile devices. We know
who do we go to?
Yeah, who do we go to? Hey, I'm going to go to Mike because Mike has been in touch almost every week for the last several months, even when we couldn't even do anything with him. I know he's there. I know he knows what he's doing. Well, Mike, let's kind of shift here a little bit and talk about this past year. Obviously, again, this our topic today is kind of this idea of what has this pandemic taught us about healthcare technology? So I kind of want your perspective from that VAR perspective of what did you learn in the world of healthcare in the last year? What are some of the challenges that you came across? Obviously, we mentioned this idea of not being able to get in front of your customers is a big one. Where did you find yourself pivoting? What surprises popped up over this time?
Well, first and foremost, we know now that healthcare technology in healthcare is not going to ever go away. In certain pockets of healthcare, they were very resistant to going to electronic medical records. Telehealth, which has been around for a long time, but now was basically forced on us, and went well. You look at the statistics around telehealth visits, they jumped exponentially, and the patient experience was very positive, rather than waiting in a waiting room and then getting called up and then waiting in an exam room. You got to sit in the comfort of your own home, waiting for a virtual session to start. In terms of the need associated with COVID, anything around the clinical endpoint, mobility solutions, medication carts, documentation carts, antimicrobial solutions, and there are a couple of really very strong products in that space. We've been doing a lot of work with ELO and LifeMed MD. We think they're best of breed complementary solutions. So we're putting a lot of focus around kiosk settings, contactless patient registration, and we see that that's going to be an area of real attention for the healthcare community going forward. I don't think we're going to see a pullback in that kind of space.
Well, we hit a lot of good ones there that we've talked about in the past as well. Going back to the whole telehealth thing, and I know you got some statistics on this as well, John, but
I do, yeah.
I was reading the one, and I'll just read it. In April, 44% of Medicare, so this is government, Medicare primary care visits done via telehealth were less than 1%. So this is back, this is back in February of last year. Less than 1%. Now, just go forward just a little bit in April, from February to April of last year. Now it's 44% of Medicare visits were telehealth.
Right.
So, I mean, just an explosion on the telehealth side that really was just dramatic.
Yeah.
To your point.
Yeah. And a couple other notes that I had about that. This is an article from health.com. There was a chief medical officer from a software company called Dr. First that said, the quote I like to cite is that we advanced 10 years in telehealth progress in the course of 10 weeks, and it's pretty accurate. And then someone else noted a 2020 report from the healthcare network Doximity estimated that 20% of all medical visits last year were conducted via phone or video, which honestly still even seems a little bit lower than it could have been.
Yeah.
But I also know, there was a bit of a decline in visits as well. I mean, I haven't actually in person seen my, practitioner, in over a year now, and again, the idea is like, well, if I don't need to, I'm not going to. I'm going to do that telehealth.
Mm-hmm.
So, what did that mean for you then? What kind of questions were you getting from your healthcare customers about telehealth, about the needs there, about purpose-built devices? Obviously, that's been a big one that, hey, we got to have devices that we can disinfect and clean, not just, standard cleaning, but legitimately use disinfectant on in order to make sure that there's no transmission. Like, what was happening in your world, and how did that escalate?
Yeah. I think just to make sure that they go and put together solutions that are, again, antimicrobial, with equipment that can be completely sanitized, do what they call terminal cleans on them, so that they're safe for reuse and as you recycle through the number of patients that they see in those environments. And it's just pervasive now. So you're going to continue to see this. I think really from a carrying telehealth forward, the only thing that really may impact telehealth is a shift in the providers, if they're the payers really. Mm-hmm. If they're right now, they think they waived all co-pays during the throes of the pandemic initially, and what guides a lot of healthcare delivery is how the payer system works. So if they continue to pay clinicians on telehealth like they do in a regular visit, then it's going to continue to be moved forward. If they kind of reduce that system to not pay at the same scale, that may affect clinicians and how they continue to administer telehealth.
That's a really good point, Mike. Mm-hmm. There's always the payee. There's always the insurance company, but the monster behind the scenes or whatnot that's pulling the levers. But honestly, from a societal standpoint, I don't see us going back. I mean, there's going to be so much demand on the user side to have this kind of telehealth and augmented. I think that there's additional opportunities out there that, okay, the telehealth is one thing, but in order to do a proper doctor visit, I mean, you still need some other technologies as well, like whatever, heart monitoring, listen to your lungs,
Right.
just some basic stuff that maybe it's a kit or something like that is sent to the home that, your doctors visit. But the efficiencies that come out, I know we're kind of drilling in here on telehealth, but just the efficiencies alone of not having to, from a person's standpoint, I don't have to get in my car, travel a half an hour to the doctor's office, sit in the waiting room for X amount of time. It's we all know it's like a 2-3 hour process minimum to go visit your doctor. Whereas a telehealth, I just log on, boop, boop, and a lot more efficient and get stuff done. So I don't know. I think the pressure is going to keep coming from our side and really kind of force the insurance companies. But your point's valid, Mike. Don't know what they're going to compensate, for that. Is it a different scale? Is it the same scale? Whatnot?
Right.
Guess we'll see.
I think with my doctor, like an e-visit is like $5 more, $5 or $10 more than a copay for an in-person visit.
Yeah.
Which I feel like kind of should be the other way around, but I guess I get it.
They're putting a premium on it, is what they're doing.
They are. But here's the thing, though. I also think of that and what you just said, and think, you know what? The people are the ones that technically sort of have the power here. I mean, in a long-term sense, we're the ones that have the power that will move this.
Yeah.
And I'm hoping that, enough of us got comfortable with this new way of doing things and this idea of, hey, as you mentioned early on, I don't have to go sit in a waiting room. I don't have to be around a bunch of other sick people. I don't have to get called back. I don't have to sit in that room for another 20, 30 minutes.
Mm-hmm.
Then, have a nurse come in and then the doctor come in, and a visit that on telehealth could maybe be 20 minutes at most is a 2-hour ordeal just to get to your doctor.
20 minutes? It's even better than
Not even
that.
yeah.
Yeah, because so my youngest daughter, Tori, we thought that she might, she had the sniffles the other day. And so we're like, okay, do we get her tested? And blah, blah, blah. We did the rapid test. But when we called up to do that, within 5 minutes, we had a doctor telehealthing with us, and she's doing the old say into the camera, and it's like and literally it took 5 minutes to assess her situation and all that kind of stuff. I'm like, how would we go away from that? That was so convenient,
exactly,
so well done. Anyway,
I imagine the seniors, the senior community, multiple visits per day, and just the strain it takes on, and the quality of life gets affected for senior citizens who have 4 or 5 doctor's appointments a week.
Yep.
That's a really good point, Mike. Yeah. Telehealth is here now, whereas automated cars to get seniors. So their doctor, the driverless, that's years down the road.
Let's focus on the here and now, what we can do, and not have to worry about that.
Hey, Mike, let's talk a little bit more about mobility. You touched on it a little bit. That has to be an area in healthcare that has really dramatically changed here, right? I mean, of course, we've touched on maybe some of the easy ones, the mobility needed for these pop-up testing, pop-up vaccination sites as well. But mobility is really starting to take a hold in healthcare in general, right? From the cart, from the nursing station. Just talk to us a little bit about what you see going on there from a mobility standpoint.
Well, it's a very successful way of improving workflow, patient workflow, gaining efficiencies at a point of capturing copay. I had a proof of concept at a city hospital last year where they used the mobile carts to go out into the patient emergency department areas, so they could just start doing documentation as the people were waiting. Not only did it help, the amount of patients that the ED could receive in a shift, but it also captured, $170,000 more of copays that they would that they got from the previous month. It was a really effective way of generating or capturing revenue for the healthcare institution, but also improving the workflow.
Yeah, I would agree.
Definitely.
And I mean, we've seen it in other industries. And as you were talking, Mike, I'm thinking to myself, we all know that a lot of money is going into healthcare. It already was. What percentage of our GDP is healthcare?
Oh, it's ridiculous. Yeah.
Whatever. And it's only
and the rest of the world
more.
Looks at us and goes, really?
Really? Yeah, exactly. But so there's a lot of money, a lot of technology that happens in there. Even if you're a reseller that doesn't play in healthcare, I would have an eye what's going on in healthcare, because that whatever is happening there is probably going to make its way into other verticals, other markets as well, whether it's mobility, whether it's not in this case telehealth, but whatever. Like, why would I go see an accountant if I had them do my taxes? We can just converse on via the video phone, or you name the service. I think a lot of those folks even need purpose-built devices, which obviously plays into our hand and what we do. here at Blue Star and our resellers do.
If you tell me that the next iteration of the iPhone or whatever could be disinfectant ready, I'd buy that.
Yeah,
Why not? I mean, it's something that's useful for me as a consumer, as just an everyday person. Obviously, there's a critical importance in healthcare, but that's the kind of stuff that could easily translate over to, and we've seen that translate over to industries too. There's been a push to talk to people in warehousing and in distribution and manufacturing.
Oh, yeah.
They're sharing devices, and again, you want something that you can easily wipe down and be clean and sanitary, so when the next person takes it, there's no concern about transmission that way.
Yep,
So,
absolutely.
I think kind of in the sense, we talk a lot. We've talked before about how, the military and government sometimes can be a good proving ground for a lot of technology that eventually makes its way into the general populace. I think healthcare qualifies in that too. That there's definitely a nice stomping ground to start there, where you try out some stuff that's a critical need in healthcare, and you find out, hey, there's applications across dozens of industries and maybe even in personal consumer world eventually too.
Yep, couldn't agree more. Hey, Mike, I want to go off a little bit of a tangent here, and not too much of a curveball, I hope, for you, because I was noticing that Agilent does a really good job at as a service and providing as a service, anything to your customer base. Are you seeing that in healthcare? Is there more of an appetite for healthcare entities to embrace kind of an as a service, whether it's device as a service or something along those lines, where you can actually sell them that type of a solution? Are they starting to embrace that a little bit more now?
Absolutely. Yeah, there is a device as a service is something that we're all kind of doing now with our cell phones. It's really, so a lot of the endpoint manufacturers, HP, Lenovo, they're starting to come up with programs. I've come up with programs, but now they're getting a lot more attention about doing a device as a service. An X amount of dollars monthly over a 3-year period will get you your device, your Lenovo, with certain specs, and if you need a replacement, and basically they control the whole life cycle management of that device. So I do believe that is certainly something we do at Agilent. We do a lot with managed services. We've got about 7 million devices under managed services contract. So certainly, doing a device as a service, we come up with some customized programs beyond what the manufacturers offer to give you a device as a service.
Yeah, and is that so? It's becoming an easier sale, is what you're saying. There's maybe not that barrier that you were facing even 5 years ago as on this whole as a service model. Right? People are starting to nod their heads a little bit more. Yeah, we see the value in having you manage the life cycle of XYZ's devices.
Yes, yeah, absolutely, Dean. And what it does also is shift that capital budget over to an operational budget, which usually it's a little bit of an easier point of entry for organizations to shift their budgets to an operational setting.
Yeah. And are you guys starting to develop even more tech stack on top of that? So you got the device management, but also, I was noticing you're starting to help your customers out with workflow optimization, supply chain optimization, things like that. So not just the device, but even starting to get into some of the workflow and stacking, solutions and software on top of that, correct?
Oh, absolutely. What it comes down to is adding value.
Yep.
So not just selling one product, but selling a solution that services kind of an end-to-end offering. So yeah, absolutely. That's always a goal for us, not to just be tactical, but be more strategic with our clients.
I'm glad you said it, because we talk about it all the time. It's so great to hear a reseller say, yep, that is the path to success.
We brought this up, I think, just a couple weeks ago, maybe, where the idea that you're not going to survive in this channel and in this world if you're just a straight up, I've got stuff that I resell.
Right.
I mean, yes, the Amazon type companies of the world, the ones that just throw up a website and sell you some stuff, that's great. And that's fine for a very certain type of person who maybe is very tech savvy and self-starter type person. But in general, I think if you want to survive in this industry and you want to, you want to grow your business and gain more customers, you've got to be willing to sell a full solution where they can rely on you for more than just a piece of hardware that you hand over and say bye-bye. It's just not the same anymore.
Yeah.
Well, Mike, let's kind of talk about what's next here. I know you have a lot of great partnerships. Elo, obviously, as he recommended you to us. You mentioned LifeMed ID earlier. I've actually done a little bit of work with them lately about, I know they're strong in visitor management. And obviously, that's one of those things that people are talking about for one reason right now, but has an extremely useful application beyond a pandemic as well. So, tell us, what are some of the things that are happening next in this industry that you're seeing that maybe haven't quite got there yet or started to take hold? Are there any interesting challenges on the horizon? What's happening in healthcare to come?
Well, I think, again, yes, LifeMed ID has been a tremendous partner. Just as a backtrack, as you want to get your cell phone protected, you recently onboarded Seal Shield as an antimicrobial solution. They've got screen covers for your cell phone, so I would encourage you to reach out to whoever is managing that relationship and get you guys some antimicrobial screen protectors for your cell phones. Shameless plug. But I think that that's just a continuation of developing and refining the telehealth solutions, and how do you make it truly contactless now, because people sometimes may be afraid to touch the screen to answer the COVID-19 survey. So how do we address that? And maybe we come up with a QR code where you can just scan it as you would if you were recently have been out to a restaurant to scan a QR code to get a menu. So just as constantly evolving products in and around telehealth that will streamline that process even further is what I look forward to. We're always on the lookout for new technologies, and certainly Blue Star has been a big help in getting us exposed to those technologies.
Yeah, it seems like those are the ones that are kind of at the top of the heap right now, as far as a lot of interest, a lot of need around telehealth. We've kind of touched on them all, I guess. Telehealth, lots of opportunity there, lots of still unmined, opportunity as it relates to that. Mobility going to continue to be a pressure point, the need to be mobile. Kiosks, I like you mentioned that. We didn't talk a lot about that, but the whole contactless nature, that continues on. And even when you do go in for the doctor visits or what have you, and you have to go on site, the more contactless that is, or kiosk driven that is, that's going to be a way of the future as well too. So lots on the horizon there.
Yeah, I think so. I think there's there's always room to grow, I think, in healthcare, and I feel like there's always going to be a constant new needs that pop up. Again, I hope that we don't have quite the needs that we've had,
or the reason why,
right, over this past year. But there will be stuff that obviously excels and moves us into the future. So,
no, totally.
Well, Mike, thank you so much for this conversation. Before we transition over to our recurring segments, I do want to, as always, thank our founding members. Of course, ELO is one of them. They recommended Mike and Agilent to us to speak with, as well as Epson, Honeywell, and Zebra. We very much appreciate your sponsorship of our podcast. Hey, if you want to connect with us, a couple different ways you can do it. First of all, if you're listening on Apple Podcasts, give us a 5-star rating and review. We just might read those on the air. It's a great way to help drive some listeners to our show. If you're on YouTube right now watching us, hit that like button. Leave us a comment. Tell us what you think of the episode. And as always, you can always reach out to us on Twitter at TechConnectPod, or email us techconnect@bluestarinc.com. All right, let's wrap things up with our recurring segments. The first is value to the VAR. Now, typically, we're doing this with some folks that aren't necessarily VARs themselves, so we're asking them to give us a little bit of wrap up our conversation and some tips that we can hand to our VAR audience. But since, Agilent itself is a VAR, we kind of wanted to ask you maybe for some tips, some advice, some best practices that you have for working in the channel and working with healthcare in particular. Obviously, don't expect you to give away the secret sauce, but if you were starting a new reseller today, or maybe you were just thinking about breaking into healthcare, you've been in other industries, what are some tips and recommendations you might have?
Well, I hope I get in trouble with my boss, but I would say that you want to look for areas of penetration that are non-traditional. So everybody sells PCs, everybody sells a printer, or kind of commodity items. So look for those products that will really allow you to differentiate yourself from the competition. Second, work in the healthcare space specifically with department heads. Again, non-traditional. Most people stick with procurement and some IT titles to go to market to. But certainly there's a great opportunity to speak with the department heads like radiology, oncology, and understand what their needs are and where your offerings can play into fulfilling those needs. And then lastly, the channel. Again, as I mentioned, the keys to the kingdom. Working with the manufacturer community and the channel to make sure that you're always letting them know that you're there to work and offer up their products, and how to demonstrate that how to properly position what they're selling. And if you do that effectively, you're going to get their commitment to, help you to get exposed to new opportunities.
Bingo, that was mine. I was going to harken back to earlier in the conversation. Vendor relations key for developing business. The stronger that is, the better off that you're going to be. You're going to be tapped in also, by the way, to things that they're working on, and you can be first to market with some of those solutions. That is so awesome when you can say, with authority, oh, by the way, we happen to work with this manufacturer and they're working on X, Y, Z, and it's coming to market. What better reason to get in? Again, when you're always looking for ways to get in front of your customers when you're in sales, it's a great way to do it. So vendor relations, don't forget about the software relations as well. We didn't talk a lot about the software partners, but they're also key. Another takeaway that I have from today, though, John, is evolving tech stack. So when, I was thinking about telemedicine, sure, it's there, but as we talked about, even that is going to evolve and there's more technology going to be wrapped around that. It just reminds me of the fact that you have to be tapped into how your tech stack, whatever you're offering and the peripherals around that continue to evolve. There's additional opportunities that can come out of your core. Got to be tapped into what's going on there.
Yeah, definitely. And I think also beyond what we were just talking about earlier, this idea of what we've discussed before of understanding that solution selling is the way of the future. It's also kind of to your point, realizing like, hey, there's going to be places you're going to have to expand, and it's going to expand your comfort zone. It's going to get into maybe areas of technology and innovation that you're not overly familiar with yet.
Yeah.
So, my opinion there is always to constantly be learning, constantly be reading up on what's going on. If something comes along and you're thinking like, yeah, that's not even something that's ever going to happen. It doesn't hurt to go down that rabbit hole and just read up about it and find out what's going on, because the innovations that you think are 30, 40 years down the road could suddenly be tomorrow's before you know it. And again, I feel like that's something we probably learned over the last year.
100%.
You talked early on about how people necessarily didn't want to they weren't ready for that shift to EMRs yet. It's been such a slow crawl to get to that. And there's still a long, slow crawl ahead of us, I think, to getting to some kind of like universal healthcare records where it's easy to jump from one provider to another and have your healthcare record follow you without having to fill out a bunch of paperwork again, without having to tell someone different the exact same story of your medical life that you just had to tell someone else a few weeks ago. We're on this slow crawl to this stuff. And I think if you're going to play in this space, understand that those pain points are out there and start paying attention to anywhere that you can help. As Mike put it, weasel in somewhere that's maybe not something people
I
are
love that
messing with
advice.
just yet.
Yeah.
Yes.
I had the word niche in my mind, as these opportunities come down and you can find a new little niche that you can exploit. Bingo.
Yep. And I like the idea also you mentioned that, hey, get outside of the zone of people that you normally sell to. It's, and we've talked about this a couple times already. This idea, it's not just the IT people, it's not just the procurement people. Go talk to as you mentioned, like the head of the radiology department, somebody in the cancer center or something. Find out what their individual issues and needs are, because you might just be much better informed when you get to come back later to those IT folks and say, hey, I know what you guys are thinking everyone needs, but I just talked to like 50 other people, and here's what they're telling me they need. So let's see how these two solutions can fit together to give you what you want to give them, what they want also.
There you go.
So there you go.
There you go.
We've solved it all. There we go. Everybody's ready to become a healthcare VAR now. Yeah, it's not that easy.
No, it's not.
Well, let's wrap up with our favorite segment of each week. What's Tech Connecting with You? This is where we go around and talk a little bit about some piece of technology, innovation, something in the world of science and tech that has caught our attention in the last week or so. Michael, let you start off here. What's Tech Connect with You right now?
Of late, I've been really interested in evaluating technology around patient experience software. So, and basically what that is being able to digitally stream content to the patient bedside to help them have a more pleasant experience in the hospital. And that could be entertainment, that can be religious content, that can be just educational information about the procedure they're about to go under, getting them more comfortable with it. So this is a title that didn't exist a few years ago, head of patient experience. So that's an area I think that I'm really interested in learning a lot more about. I've had some really solid conversations with a couple of software players in that market. So as I go through, I think that's an area of interest to me to see how that plays out, but the overall patient experience and how do we make it better.
Yeah, really good point. I never thought about that. The hospital didn't need a patient. What's patient experience?
But that's just it. It
No,
always
we got
should
this
have been
curtain.
there.
Sit down in the bed. And
Right. But that's just it. Again, we talked about hospitality a couple weeks ago with Shannon from Volante, and she mentioned this idea of like the hospitality ambassador of some sort. This person whose job it was to help you understand, like, hey, here's all the things we offer. Here's the things you can do. Here's where you can go to do this and where you can go to do that. Why wouldn't you have something like that especially in a profession and in an industry where people were automatically walking in the door with their anxiety levels at a high level?
at max.
Yeah, I don't care if you're just going in just for a simple cold or a cough or whatever. It's always a bit of a stressful experience having to go to a doctor or to healthcare, but especially if you're in a hospital, if you got surgery, whatever it is. Why wouldn't you be looking for ways to make that as pleasant as it's going to get for somebody and making it a good experience for them?
Yeah. So, Mike, I mean, I guess, through technology, the patient experience is gonna be revolutionized here, I guess, over the next decade or so, because think of the competition, right? We all go to hotels and stuff like that. The experience there is completely different than what would traditionally be viewed as the hospital or healthcare experience. Very antiseptic, very cinder block, very,
Right.
Whereas now, to Mike's point, I guess the transition is over to a better overall experience, which, by the way, helps their scoring, which helps them in their how much they get compensated, right, as well. So, premium being put on that whole customer experience. There you go, patient experience. I'm sorry, patient experience, not customer in healthcare.
Hopefully, we can stop thinking about people in healthcare as customers someday. But I know that's just how the industry works right now. But yes, the patient
You're
experience.
a customer. Yes.
Dean, what's Tech Connecting with you right now?
You ever heard of a data trust?
I have not.
So data trust. So, technology companies are really bad, poor stewards of our information, right? Our personal data. You hear about it all the time, hacking, and now I've lost all my personal data. You've got whole regions like Europe trying to implement the GDPR and like locking down things. Well, the idea of a data trust is an alternative to that, where some governments are actually starting to explore these. But the idea here is that a data trust is a legal entity that collects and manages people's personal data on their behalf.
Interesting.
So it's like a third-party entity that is managing your personal data and how it is utilized.
So it's like a password manager on steroids.
Yeah, way on steroids, I think, because this gets into healthcare information.
Right.
It gets into governments are considering using it, and it's like a third-party entity that would be regulated and structured and all that. So just like a trust is, like on a family's trust or something like that, or farm or something along those lines. So it is a concept though that you would formulate these trusts, and governments would utilize them as like this, again, third-party entity that's now managing that, and it becomes in the workflow. And I don't know, there's something to the whole idea of data trust. Maybe that's a way of getting through it, because here in America, I mean, right, we're not going to get there unless there's something like an idea like this, where it's a data trust rather than the government or coming up with some kind of policy that everybody's going to.
But how do you get people to trust the trust?
Well, yes, right. You have that as well. Of course, that's in there. But we'll see. We'll see how it pans out. But now you've heard about data trust, so if you start hearing some chatter about this, it's one of those hot technologies that might start taking off.
Although Dean was on top of this already.
There you go. I'm on it.
I still find it though funny sometimes, like as much as we all are concerned about privacy in our data, and yet there's so many places we're willing to just share everything without even
or just hit accept,
thinking about it.
Boom.
Yeah, exactly. But then every now and then people get like, "Oh no, what's this doing with my data?" I'm like, "Really? You just like shared 30 pictures of yourself on Facebook 5 minutes ago and told everyone where you were in the entire country." But whatever.
Exactly.
So for me, all right. So we've established over the last year we all wanted to stop touching everything. Like everything was just gross to touch.
You've established that,
fine.
But anyway,
I know it's been a recurring gag for me. Well, if I recall, there was a couple times during the pandemic when people were talking about like elevators. And one, elevators obviously was a little scary because you get into a confined space with somebody and breathing in each other's
air's
air.
all being shared, right?
But, you got to touch buttons on an elevator.
You got to touch
and
buttons.
I've never liked touching buttons on an elevator. Again, it's my little germaphobe thing.
Yep.
Well, there's a company, a Singapore company called Stuck Labs that has come up with the Connect Touchless Elevator button. And basically, it's just giant number buttons, not giant, but like, probably, like maybe a couple inches tall or
Okay.
whatever. So
Yeah,
it's
yeah,
a
yeah.
clear visible button that actually has a little bit of a sensory field that's coming out from it. So you can get your finger close to it without quite touching it, and it will light up, indicating that it knows that that's
There
the button,
you go.
that's the number you want. I think if you like press in a tiny bit more, hold for a little bit, it'll identify that as, okay, this is the one you've selected, and then take you to that particular floor.
I gotcha.
Very simple. This is one of those
Why don't we have this
extremely
everywhere
simplistic
now?
technologies
Yeah.
that just makes a lot of sense.
Yeah,
and there's
proximity
no reason
sensor.
not to do this. Yeah, exactly.
Yeah. Okay, so that's
there
in
you go.
Singapore?
Well, it's the Singapore company that's come up with it. I don't know where they've actually.
Oh, dang it. It'll take forever to get over
It
here.
probably like it'd be one of those things other countries are doing forever, and then people come to America and be like, "Why do you still touch all these filthy buttons in your elevators?"
Yeah, well, Yeah, maybe the old days when the elevator operators were in there and they would press the button for you. You just said, "Hey, take me to whatever."
Yeah, but
this is the modern version.
Yeah,
of that.
exactly.
Yeah,
We're in the
I like
modern
it.
world
I
now.
like it. I want it. Yep.
So that's what's Tech Connecting with us. Mike DeLibero from Agilent, thank you so much for joining us today. We appreciate having you on the pod.
Thanks, Mike.
My pleasure, guys. Happy to be here.
All right, as always, it is time for us to unplug. So until next time, folks, please stay connected. Trying to help your customers open or reopen safely with social distancing and infection control protocols? Elo offers touchscreen solutions to help with employee access, guest check-in, self-service, and much more. Their modular platforms increase safety, eliminate paper-based processes, and reduce the cost of visitor management. Elo also provides thorough cleaning and disinfecting guidelines. To learn more, visit Elo's microsite on bluestarinc.com or contact your Elo representative. Delivering high-quality patient care starts by connecting data from admissions to discharge and every step in between. Zebra's patient identity management solutions enable precision when matching patient records, medication, specimens, and more, so the right patient gets the right care every time. Built from a connected ecosystem of scanners, printers, and supplies to help ensure treatments and medications are accurately administered, Zebra's patient identity solutions give clinicians the performance edge they need to deliver safe and accurate care. To learn more, check out the link in the show notes or contact the Blue Star Zebra team.